Did you know that 7 out of 10 Americans who have medical bills say that they have to lower their spending on food in order to avoid a medical bankruptcy? Navigating our highly complex world of healthcare and health benefits leaves many people feeling like a snowball in, well, you know where. I'm Josh Butler, healthcare consultant and advisor to more than 150 employers around the country, and this is A Snowball's Chance in Healthcare, a show about restoring hope in healthcare. Join us as we discuss ways you can lower your healthcare and benefits costs, how companies are winning the healthcare and benefits battle, and how hope is being restored to this community and communities across the country. Hello again, and welcome to another episode of A Snowball's Chance in Healthcare. I'm Josh Butler, president of Butler Benefits and Consulting. We are a boutique consulting and brokerage firm located in Amarillo, Texas. And I'm also the host of this here program, A Snowball's Chance in Healthcare, where every week we're sharing tips and strategies, and we're hosting guests and sharing solutions and resources to give you a snowball's chance in healthcare. Help you lower your healthcare costs, help you get better access to care, have better quality outcomes, better patient experiences. And today I'm really excited because I've got a very dear friend on the program with me. Bret Brummitt is the president and founder of Generous Benefits, located in Austin, Texas. And he's a benefits consultant like I am as well. But they are an employee benefits consulting firm with a more generous idea of what benefits include. He doesn't just sell insurance, ladies and gentlemen. He is all about being very generous, and he's very giving in his time and in his consulting services. Bret Brummitt, welcome to the program, my friend.
Fantastic to be here. Really, really excited for the opportunity to be here, talk to you, trickle into someone else's ear. Sounds like a great time.
I've been waiting 18 weeks to get you on the program, and today we got a good topic to discuss.
All right, I'm excited. Let's jump into it.
Yeah, so I mean, you know what this program's all about. Like I said at the top, it's all about empowering people and educating and giving them resources and tips. And you know, we're doing a little prep for this show. You had a really good. I'll let Bret choose the topic of this week's episode, and it's all about empowering patients and preparing people to encounter our massive and our convoluted and often frustrating healthcare system. And, you know, before they get sick, oftentimes, you know, if people aren't prepared, then they're not taking good advantage of our healthcare system or asking the right questions. And it oftentimes will lead to more expensive episodes of care. So today we're going to talk a little bit about building a strong patient, being a good consumer, but knowing these things before you have an encounter with the healthcare system. And so as we were brainstorming from this episode, Bret, you had mentioned 3 things. You had listed 3 things that you wanted to talk about and discuss. And it's these 3 things that people really either should know or what they should do before they encounter our healthcare system. And this first one is, I mean, some of these things seem pretty obvious, like thanks, Captain Obvious, but honestly, nobody does this stuff. Number 1, plan on where are you going to go? Where are you going to go? Let's talk a little bit about that.
Yeah. I mean, so often, you know, you and I are in enrollment meetings. We're talking to employees. We're talking to individuals. And we find out they haven't been to a primary care doctor in 8 years. They're living somewhere where they haven't established a primary care relationship. Like the idea of primary care is, hey, I'll let the urgent care, the click minute clinic down the street, you know, somewhere take care of me. Or I'll just use you know, as much as I love it, I'll just use the telehealth. But we're talking about like drive-through medicine. Like you can't build a strong body taking fast food every day. So let's go ahead and really start with that good foundation. Let's establish a primary care physician. Super important to have. It can open up so many doors, and especially when you're sick. Like if you don't have a primary care physician relationship, they don't want to see you when you're sick for the very first time. Like the access to care, like let's forget price, let's forget insurance. Let's just talk about getting on their schedule.
That's
like,
right.
If you don't have that established patient, let's do that. And that's really the first spot. And then you can figure out, once you have that established, do you need to go in? Could you do it with just a telemedicine visit and come back to your primary care physician? Could you go to urgent care because it's, you know, 8:30 on a Tuesday night? Like,
right.
those are the right locations at that right time. Hey, you need stitches, your doctor's office closed. yeah, let's go to the urgent care. Let's not try to wait till the doctor's office is open if you're going to have stitches and you're, bleeding.
Exactly.
Well,
And I love the point you make about, the difference between being an established patient
mhm.
and a new patient. Okay. Now, in difference in time, you mentioned that if you're not an established patient, it's going to take you some extra time. But ladies and gentlemen, those new doctor visits are typically a little bit more expensive as well. They
Mhm.
cost a little bit more, because that doctor's anticipating needing to spend a little bit more time with you, and the administrative task going to have more paperwork for you to fill out. And so, that's a great point, is be prepared and already be an established patient. Now, that's the second thing that you pointed out,
Mhm. Yeah.
that I really liked is that using your annual wellness visit, because most health plans these days, per the ACA, all commercial health plans these days have to cover a wellness visit at no cost to the patient, right? Talk to the audience a little bit about your idea, and your tip about using your wellness visit as an additional opportunity, not just to get a wellness checkup, but to do what?
Yeah. Go ahead and get yourself established. Let's not pay for that more expensive visit. Let's use the freebie. Let's use that annual well check, and we can go ahead and vet a new physician, especially if we don't have one, or if we don't like the one we have, or they're retiring, you're moving to a new location.
Right.
Use that annual well check. Go ahead and have your wellness exam, your preventive checkup with a new provider, and use that opportunity to find out about, do you like the office? Do you like how long the wait times are? Do you like the provider? Set those expectations, like find out, ask them tons of questions, like how do they get back to you? What's the response time? Are you going to call? Are you going to do everything on a portal? Is it a big system app? Or are you just going to have old school, pick up the phone, call, schedule an appointment? Learn what it's going to all be about. Use that opportunity. It's free.
Exactly. And not a lot of people know this about you, Brett. Now I know this about you. You and your wife are kind of jet setters, and
Mhm.
I know your hub is in Austin, Texas,
Mhm.
but you guys just spend an extended amount of time in the Northeast and in Washington, D.C. area and up in Maine. And by the way, the photos up there looked amazing. I know that you're back in Austin now, but you have to reestablish relationships with primary doctors pretty frequently, because you and your wife will go places and stay for extended periods of time, like up to a year. And
Mhm.
so, I mean, obviously, so ladies and gentlemen, he knows what he's talking about when he's talking about how important of a resource this is, to use that freebie, that wellness visit per year. It's almost like a free look period. You can go in there and you can kind of vet your doctor and interview your doctor. And if you don't like them, guess what? You can go to another doctor. There's nothing that says you have to stay with your primary care doctor. But Brett, you made the biggest point was, it's shocking to this day about how many people, um, they don't even have an established primary care doctor. And I think that's a big reason why healthcare costs get driven up year to year.
Yeah. I mean, the faster you have to go to, quick episodes of care,
Mm-hmm.
the costs go up. We're not having that relationship of someone that knows you. I mean, heck, I passed out and I think I may have died on your back porch, but thankfully I didn't have to go to the ER because my doctor's known me for a while, and he actually did a stress test. And so he knew what my heart looked like. He knew everything else. A couple phone calls and 30 minutes on a blood pressure cuff. And I didn't have to sit in an emergency room.
That's right. And I remember that night. It was a unique night, and God bless telehealth, because
Yeah.
that did avoid it wasn't a serious condition, ladies and
Yeah.
gentlemen. He didn't have a stroke or a heart attack or anything like that, but he did have an episode of care on my back porch. But
Mhm.
I mean, what I hear you saying is that, you need to have a plan. And it's kind of like, when we were kids growing up, they even taught us this in schools, and things like that, tornado drills and fire drills and things of that nature, is that you have a plan, because often these are traumatic events that happen. Like if your kid's hurt and you got to take them to the ER, you're not going to be thinking about your financial decisions that need to be made in that moment. You're going to be thinking about taking care of your kid. If you don't have a well-established plan that you've thought out and you've practiced it and you've really maybe even made a list, then it can be like, this is why they do fire drills and this is why they do tornado drills. And so when little kids, if there's a tornado coming, you have a plan. Well, the same thing we need to be doing, Brett, with ERs and urgent cares in our neighborhoods. Talk a little bit about that, about having a plan in place as a family for when people get sick.
Yeah. I mean, and so I would say if you're actually vetting for a family, when you're vetting the primary care, figure out if they have weekend clinic hours. Like maybe that clinic has a set of weekend hours, so you're not going to the urgent care if you don't have to, or the emergency room on the weekend, especially if you're talking about a practice that does pediatrics or family care. Because you can do a lot in the primary care office if they're open and able to see you. I mean, that's really what the urgent care clinic has sprung up from. I mean, you have long ER wait times or closed primary care offices. So the urgent care is fixing that middle gap. You have virtual health visits, which as long as they don't have to lay hands on you and figure out, what that warm sensation on your belly is, those are great options too. But then you have a whole new range of urgent care versus freestanding ER versus actual facility-based ER. Wait times, what kind of care, and then cost. I mean, cost becomes a big issue on the consumer, especially when it always seems like the most critical items happen after an insurance company is closed. Like they don't know, they won't be able to verify you have coverage. They won't be able to verify if you're in network. You're going to have to pay a certain amount at the point of service. And you need to figure out also if that's just a primary care clinic. Is it a walk-in convenience clinic? Is it an urgent care clinic? Is it a freestanding ER? Because the price of each of those goes up, each single one of the levels. I mean, you're talking like a CVS Minute Clinic. That's going to be the lowest price area you're looking for in person. And then you go to an urgent care, that's going to go up. And then if something goes to freestanding ER, and urgent cares a lot of the freestanding ERs have an urgent care operation and a freestanding. And so you can ask those questions as a patient. I've actually been in and they wanted to do extra imaging for me while I was there for flu-like symptoms. I was vomiting in their bathroom and they wanted to do GI imaging, but that would be emergency room issues. And I delayed those because that didn't seem prudent for me given the dollar cost of what was severe flu-like symptoms.
Right. And that's a good segue.
Yeah.
It kind of comes to the second point, out of the three things that people should know or do is secondly, you should know how you're going to pay for it. Knowing your options. We talked a couple of episodes ago about HIPAA high tech and people's rights that they have a right to file claims with their insurance or they have a right to pay cash. And so knowing these, your insurance plan and what facilities and providers are in and out of network, what else, Brett, can people do to plan on how they're going to pay for healthcare?
Yeah, I mean, I would say that it's hard to do, very, very hard to do. I mean, have a little healthcare fund set aside, some kind of cash account, whether that's just your personal account, personal budgeting, savings, employer-based FSA, HSA type plans. Make sure you have one of those because sometimes cash or credit debit card, that's got to be your bridge to actually getting access way too often, especially if we're talking about after hours. Now, I would also say, if you're being charged something, ask how little of that bill you can pay. Like, can I only pay $75, $100 today while we figure out if insurance is in place? Can you put my card on file, especially if you have like an HSA account? Can you just keep my card on file until the insurance has been billed? Because it's hard to get money back out of a provider's office, even though they should. Like going back and getting that, they're not actually allowed, I believe they're not allowed to hold a credit balance, but most of them do for the next kind of services.
Yeah, absolutely. And we're seeing that more and more and more frequently as we see the prevalence of high deductible health plans just continue to grow. We are seeing more and more providers, especially hospitals, that are charging patients up front. It doesn't matter. They don't care if you've already satisfied your deductible. You can tell them, I've got Blue Cross Blue Shield and I've met my deductible for the year. Who cares? You're going to pay $3,500 down. And, once we verify your benefits and we file those claims and we get an EOB, then we can work on a refund and just it's so, yeah, that's a great point about having a little reserve fund put aside, for emergencies and things like that. Even Dave Ramsey talks about having an emergency fund that, that does include medical events. And so now the last point, what people should know and what people should go ahead.
Super hard to do, like having the emergency fund, especially if we're talking about, we both sell insurance products. We're taking most of everybody's paycheck.
Right. No kidding.
How are they supposed to save if we have this coverage issue? And again, but you've covered this, the discoupling of healthcare from health insurance. One, they go together, but they are also opposed when it comes to having some of these items prepared in advance.
Yeah, absolutely. Good point. Now, the third one that people should know or do is my favorite. And I want you to tell us, who's in charge of this doctor's appointment? When you go to the doctor, talk about that, Brett.
Yeah, when you go to the doctor's office, you are in charge. Now, you really, really have to almost like practice and role play this ahead of time, just even showing up. I mean, you have to remember when you show up, you are actually the one paying the bill. Like you are the customer. The most sadly, most front offices will treat you as if you're just part of a Blue Cross system, a United Healthcare system. You're a cog in the wheel. You have to go with the mindset that you are the customer. They are the one you are paying. Regardless of who's paying that bill on the back end, you're paying it. You're the customer. So start with the mentality of you're the customer. Make sure you know what you want to achieve for that visit. Now, if it's an urgent care emergency, it's probably very singular in focus. There's something that's needing to be taken care of. If it's not, make sure you have a checklist of everything you want to address. When you finally get to see a provider, you want to make sure that you're getting the answers you came in for. A lot of us will get in there and we just forget what we're there for. I've seen the smartest people in the world at a doctor's appointment go in. They had 4 or 5 questions they wanted to answer. They asked 2. They get kind of sidetracked through what the ramifications of one are. They leave the appointment. They never asked the 3 other questions. And 2 of the things they talked about, they forgot one of them. So have a checklist of what you want to know when you go into the doctor's office.
Yep.
Write it down. Like even just have notes on your cell phone if that's what your area is, or have a piece of paper, have a journal. Write down the answers. Ask the doctor if they're okay if you record the conversation with them, because I've left a doctor's appointment and I don't remember half of what we talked about in detail. I can go back and listen to that or look at my notes and say, oh, that medication was only effective if I took it with medication. Like that's the only way the digestive system worked. Like you forget that one little piece out, even though you filled your prescription. Well, now you're not being the most effective or having effective medications. And this is not where you want to go. You don't want to have to be on a healthcare journey very long, right? You want to be on just living your optimized life, being healthy, being well. So go in with an action plan and have the expectations set, especially about follow-up. Like how is the follow-up going to work? Like we've gone in for the doctor's office. Is follow-up going to happen via a patient portal? Am I going to have to come back into the office to talk to you twice? It'll be a telemed visit. Go ahead and line those things out. Because again, you are the patient. Your time is valuable. Your time to get better is super valuable. And then, you don't want to have to delay that any more than you have to. So find out those expectations, set your preferences. Tell them you don't want to come back in to read lab results. Do a telemedicine. Don't take time off work to go back and do that when it can be handled more effectively and more efficiently. It's going to save time for the provider too. So go ahead and be a little demanding.
Yeah. And, listen, we're not advocating to be Dr. Google here or to, argue with your doctor. We're talking about just being thorough. But it's really, really hard for people because we're raised in this culture, especially here in Texas and in the South, to be, very, very respectful of doctors. And you don't question your doctor. You don't question your kindergarten teacher, and you don't question your parents, and you don't question your pastor. There's a few people in this, in our culture that we're conditioned not to question at all. And we're not saying question in a way to, question their authority or their expertise. We're not trying to be doctors here. We're talking about just being thorough and fighting for your time with your doctor and being a good advocate for yourself. And so, Bret, share a few examples of some of those right questions that people should ask in their doctor visits. And a lot of people may feel uncomfortable asking specific questions to their doctor, but trust me when I tell you that it's if you do it in the right way, doctors should not get defensive. And if they immediately start to get defensive just because you're asking good questions, then you'll have to make your own decisions. But that really irritates me if I start asking my doctor's a DPC doctor, so I mean she'll sit there and talk to me for 3 hours if I want to. But most people that are seeing fee-for-service doctors, what are some great questions that they can ask when they go in?
I mean, again, ask the questions, help you understand what that healthcare journey is going to look like. Are we talking about, like, if it's a recommended treatment, whether it's a drug, a therapy, how long should I expect this to last? How should I know if it's working? How should I know when to come back if it's not working?
Do I really need it?
Do I really need it? Or basically, what's the outcome? What's the outcome if I do this? What's the outcome if I don't do this? I mean, sometimes you'll get offered extra imaging. You may not want to have a higher radiation load in your body just because of all the extra imaging. Same thing for antibiotics. Antibiotics are a great one to ask a question of, what will it look like if I don't take the antibiotic?
Correct.
None of us want to build up antibiotic resistance. And personally, I want to save some of those for maybe later end of life type stuff. I don't want to have to be resistant to that later on. So can I avoid taking those early on when we're just kind of throwing a shot in the dark that we don't know exactly what's causing it, but an antibiotic might clear it up. So ask the questions of how long should it take to get better? What happens if I don't do it? What are the downsides? What's their side effects? And then, is the treatment,
Yeah.
what are we looking at? And
yeah, here's another great example where we see it very, very frequently. And I learned this from my wife, and I've learned this from other ladies in our office that, oftentimes when women go in for their annual mammogram, they'll get a mammogram, and then all of a sudden they get a call back. They get a call back, and often that triggers a lot of anxiety. When I can only imagine you get an image and you go have a mammogram done, and now your doctor's calling and saying, hey, we need you to come back in and do a call back. We might have saw a little something here. That's a great time to pause and just talk to your doctor very frankly and very, ask these questions, because you know what? My wife's done this twice, 2 years in a row. She got called back for an MRI, but when she called her doctor and her specialist and said, hey, look, do I really need to come back in? He's like, no, we really don't need to do another MRI. We really don't need to do another this or that, So oftentimes it's just one of those things that you never know why they're calling you back. So that's a great time to pause and I love the antibiotic, example as well.
Yeah,
So,
and I was going to say, there's some great examples. There's an organization out there called Choosing Wisely. They have the printed cards that you can just kind of keep in a wallet card. They have a mobile app to keep on your phone in case you can't think of what to ask your doctor. They'll go through different services. And as an employer, someone sponsoring a health plan, they kind of go through these and help, become better consumers. I hate to say consumers of healthcare because we're really not. We're the byproducts. We're actually just living life, and healthcare comes in and out.
Exactly. Well, we got a few more minutes here, Brett, and I want to get to this aspect of, this parallel to mental health and what employers and employees can do. A lot of times there's a lot of mental health benefits that are built into health plans that just kind of get overlooked. They get pushed aside a little bit. Give us some tips and a little bit of information about, these EAP, these employee assistance programs that people need to be taking advantage of.
Yeah. So an employee assistance program is typically designed to have some amount of face-to-face counseling visits with a mental health provider, as well as telephonic visits. So these are benefits that are often sold on the employer basis as like a add-on perk or almost like a throwaway program when an employer is buying them. They'll be tied to a life insurance plan or disability plan. Our company, we actually have two of them. We have one through our health plan and one through our disability plan. Both of them have 6 free face-to-face counseling visits per year. I'm using one of them right now to find a new counselor in my current hometown. My old one retired. So I'm, again, using those free provided visits to interview and see if I like a new counselor. Same thing goes for kids. It's for the household for most of these plans, and being able to have something that's accessible and not having to pay an arm and leg, because mental health providers, counselors, psychiatrists, psychologists, they can be expensive, as most of them have opted out of most insurance systems. And a cash pay system, you can be looking at anywhere from $110 to $400 a visit, especially if you're talking like high medication management. And having a way to do a plan, especially as an employer, having a resource for those employees and treating it as a resource. Most employers I've known treat it as an afterthought, treating this as valuable as the dental program, something, talk about something that's going to cost you way more money in life than a dental visit will, in a mental health episode. And finding, like I mentioned earlier, finding a mental health provider in network. We do have some regulations on the plans that are forcing them to get better through the mental health parity, but it's still a long way to go as a consumer, especially if you're in a crisis or you got a kid that needs something. Finding someone that'll take you in, finding someone that'll take a new patient appointment. And I will harken back to this. This actually is back in the primary care scope. So you may not always have to go straight to a mental health provider. A primary care office, if the provider is comfortable with it, is trained in some aspects of mental health care, and you have that to start with. You can also, again, if you have that relationship with a primary care provider, they can help get you in faster to a mental health provider they know. A call from your primary care physician can cut weeks and maybe even months. A lot of in our area, the mental health provider time to get in as a new patient can be 6 to 8 weeks. And if you've had a kid that's going through something, yourself going through something, spouse, you can't solve this stuff 6 to 8 weeks after the fact. Like, that's a lot of time to wait to start getting treatment, advice, figuring out what's going on. So again, use the EAP, make an established relationship through that. I mean, those are free visits. You take advantage, go early, go often. And I think this is one of those things, much like an annual checkup or just trying to live healthier, trying to live mentally healthier with all that we have going on in our world. Stimulus coming in. We have some more stimulus coming into our brain now than we've ever had before, and being able to sort through, reset, just have tools to deal with stress and anxiety. Very, very useful things to go ahead and get ahead of the curve on.
You bet. Well, Brett, we run over our time a little bit.
Yep.
It's all great information, man. It's really good stuff. Become, be ready, folks, for these doctor visits before you become a patient. Having a plan can save you money. It's a great tip. Lots of good information today, Brett. Thank you so much. That's going to do it for another episode, ladies and gentlemen, where each week we're sharing information, tips, strategies, stories, solutions to give you a snowball's chance in healthcare. We'll see you next week.